Test. Thank you. Good morning, everybody. Welcome to the Health, Welfare, and Institutions Committee. I understand that we have some students here from the Virginia Tech Carilion School of Medicine. Why don't you stand up and let us know who you are? And thank you. We've heard a lot about your school, and congratulations. It's one of the great newish Virginia success stories, and thank you for what you're doing to revitalize Roanoke City and the whole area down there. So thanks for coming. Hope you learned something, but that'll be hard. It's difficult. We speak in a different language sometimes. So thanks so much for coming, and look forward to meeting you in person later. Before we get started with the subcommittee reports, I'd like to entertain a motion to strike Delegate Gudaitis' HB 312 at her request.
So moved.
We take a vote on that. So please register your vote on the electronic voting machine. And also at the request of Delegate Gudaitis, the vote on that striking that legislation is 20-0. Moving along, another bill that she introduced, HB 1468. She also requests that that bill be stricken. So I entertain a motion. There's a motion and a second. Please register your vote on the electronic voting system. And that bill is stricken on a vote of 20-0. And then the chairman here has a bill that has been overcome by events and actually is now being carried by the gentleman to my left from Albemarle County. So I will strike my version, HB 1662. Is there a motion to do so? In a second. It's been moved and seconded. Please register your vote on the electronic voting device. And that bill is stricken on a vote of 20-0. Thank you very much. So moving into subcommittee reports, we may come back to full committee later, but for the audience who may have missed all the fun, all of these bills that are being reported out from subcommittee have received a full and fair hearing, lots of them for a long time. And so we're not going to hear the debate again unless there's something new that somebody out there has to give us that we may not have heard. And we'll move first to the Health Subcommittee report by Delegate Hope. And you've got the floor.
Thank you, Mr. Chairman. Members of the subcommittee, we met last week and reported out several bills favorably. The first bill on your docket is House Bill 180, patroned by Delegate Levine. This is records of marriages, identification of race. It eliminates the requirement that the race of a married parties be included in the marriage record filed with the state registrar. We incorporated bills House Bill 141 by Delegate Davis, House Bill 1158 by Delegate Lopez, and House Bill 1425 by Delegate Sullivan. House Bill 180 was reported with a substitute by a vote of 8-0, and I so move. House Bill 479, patroned by Delegate Kilgore, expands the list of parties eligible to obtain a free certified copy of a veteran's death certificate to include any funeral director.
Mr. Chairman, point of order.
Yes,
Do we not need to act on these individually?
Yes,
Oh.
yes, we do.
You know what, Mr. Chairman, I was in the courts committee mode where we do all the uncontested
Well,
and block, but I will not
Well,
do that.
this is not courts committee.
I'm
we
so
have to
sorry.
consider all these things,
Mr. Chairman.
one at a time. But you were motoring along there. That was very quick. So
It's efficiencies.
yes. So the HB 180 has been moved. As we know, it doesn't require a second. And so all in favor of HB 180, please register your support or opposition on the electronic voting machine. And that bill passes on a vote of 20-0. Delegate Hope.
Thank you, Mr. Chairman. House Bill 479, but Delegate Kilgore expands the list of parties eligible to obtain a free certified copy of a veteran's death certificate to include any funeral director or funeral service licensee who provides funeral services to the veteran if so requested by the surviving spouse of the veteran. House Bill 479 reported with a substitute 8-0, and I so move.
Okay, HB 4, the substitute is before us. All in favor say aye.
Aye.
Any discussion on substitute? HB 479 is before us. Please register your support or opposition on the electronic voting device. And this death certificate for veterans bill passes on a vote of 20-0. Delegate Hope.
Mr. Chairman, House Bill 586, I believe there are some amendments. Do we want to approve those first?
Mr. Chairman, Delegate Hope, I think we need to reject the committee amendments, and then we have a committee substitute.
I would move.
Okay, all in favor of rejecting the committee amendment, say aye.
Aye.
Opposed? The council will now distribute a substitute. Ms. Chair, do you want to go ahead and explain the substitute?
I just got the substitute just now. I don't know if Delegate Guzman.
We need one of these medical students to do this bill because it has perfluoroctanoic acid, PFOA, and then PFOS, and then PFAS, and I can't say those words. Okay, so council, please explain the difference.
Yes, so this bill came out of subcommittee with a large number of line amendments that are available online and have been distributed in your subcommittee packets. Following this subcommittee, we received information that we needed to add back into the list of substances the last piece about and other perfluoroalkyl and other polyfluoroalkyl substances, PFAS, as deemed necessary. So in light of the number of changes, we did a substitute that incorporates all of the line amendments out of the subcommittee, and adds that language to this bill.
The substitute is before us. Is there a motion to move the substitute?
Move the substitute.
Second. The substitute's been moved and seconded. Does anybody oppose this clean water bill? Okay, all in favor of reporting out HB 586, please register support or opposition on the electronic voting machine. And the bill reports 21-0. Thanks for coming. And Delegate Hope.
Thank you, Mr. Chairman. House Bill 661, patroned by Delegate Bell. This directs the Secretaries of Health and Human Resources and Public Safety and Homeland Security to establish a work group to develop a plan to improve the Commonwealth's response to exposure-prone incidents involving employees of law enforcement agencies, volunteers and employees of fire departments and companies, and volunteers and employees in emergency medical services and other appropriate entities. The bill reported 7-0, and I so move.
Are there any questions about HB 661? If not, you can register your support or opposition on the electronic voting machine. And the bill passes by a vote of 21-0. Delegate Hope.
Thank you, Mr. Chairman. This bill, House Bill 666, patroned by Delegate Mullen, expands the definition of dead body for the purposes of the administration of vital records and prohibition against disposal and concealment beyond the recently deceased to include human bodies or body parts in any state of decomposition. This bill was reported, but I do believe because it needs to be referred to the Courts Committee, so I would move that we report with the amendment to report and refer, and it was reported 8-0.
Move the amendment. The amendment has been moved. Is there a second?
Second.
All in favor of accepting the amendment?
Aye.
And the motion on the bill would be to report with the amendment and refer to the Courts of Justice Committee. Is there a second? Okay. Please register support to report and refer on the electronic voting machine.
I know.
And the bill is referred to the Courts of Justice Committee on a vote of 21-0. Delegate Hope.
This one also has a substitute. Can I move the substitute?
HB 688. The substitute's before us. Is there a motion to accept?
Second.
So moved.
Okay. Without objection?
Thank you. Thank you, Mr. Chairman. House Bill 688, patroned by Delegate Aird, requires the Department of Health to approve one or more entities to certify community health workers in the Commonwealth and prohibits a person from using or assuming the title of certified community health worker unless he's certified by a credentialing entity approved by the department and submits an application to the department with evidence of such certification. The bill defines the terms certified community health worker and community health worker. The bill was reported with substitute 8-0. It also incorporated Delegate Guzman's bill of House Bill 474. As I said, the bill was reported 8-0 with substitute, and I so move.
Is there any further discussion? If you support HB 688, please register your support on the electronic voting device. And the bill is reported out 21-0. Delegate Hope.
House Bill 737, patroned by Delegate Watts, requires regulations establishing the staffing and care standards in nursing homes to require a minimum number of hours of direct care services to each resident per 24-hour period, which minimum increases in specified phases from 3.5 hours to 4.1 hours. The bill was reported and referred to appropriations by a vote of 8-0, and I so move.
Thank you, Delegate Hope. This aspirational bill needs to go to Appropriations Committee, and if you support the bill, please register that support or opposition on the electronic machine. Thank you, Delegate Watts. I see you in the front row there. Delegate Hope.
Mr. Chairman, House Bill 1041 was reported with a substitute, and I move the substitute.
Second.
All in favor of the substitute, say aye. HB 1041.
Mr. Chairman, this bill establishes that upon request of a person and in accordance with the requirements of the Board of Health, the state registrar shall issue a new certificate of birth to show a change of sex of the person, and if a certified copy of the court order changing the person's name is submitted, to show a new name. The requirements related to the obtaining a new certificate of birth to show a change of sex may include a requirement that the person requesting the new certificate of birth submit an affidavit provided by a health care provider from whom the person was received treatment, stating that the person has undergone clinically appropriate treatment for the purpose of gender transition. Requirements related to obtaining a new certificate of birth to show a change of sex shall not include any requirement for evidence or documentation of any medical procedure. The committee's recommendation was to report with a substitute 5-3, and I so move.
Delegate Orrock withdrew his request to speak button. Council requests that we move to the next bill before we vote on 1041 due to a line amendment that might be needed. So, Delegate Hope, HB 1090.
Yes, Mr. Chairman, House Bill 1090. This had a substitute, and I'd like to move.
Move the substitute. Without objection.
House Bill 1090 provides that the Board of Health's regulations for the immunization of school children shall be consistent with the immunization schedule developed and published by the Centers of Disease Control and Prevention, the Advisory Committee to Immunization Practices, the American Academy of Pediatrics, and the American Academy of Family Physicians. The recommendation was to report with a substitute and refer to appropriations by a vote of 5-3, and I so move. Oh, and it incorporates House Bill 1489.
Thank you, Delegate Hope. Delegate Orrock.
Yeah, Mr. Chairman, if I may, just speaking to the matter.
The gentleman has the floor.
Yeah, Mr. Chairman, just so the committee understands, what this bill does is takes our current statutory provision whereby we as a body politic determine what immunizations will be required for the citizens of the Commonwealth and totally cedes that to the Center for Disease Control. We have always used their recommendations, emphasis on recommendations, as guidance in making that determination. But just so the committee understands, that's the premise behind many of the negative votes, that this will markedly increase the number of immunizations that will be required of individuals going into school in the state, and prospectively, annually, we'll have that modified as the Center for Disease Control automatically recommends. Thank you.
Any further discussion?
Mr. Chairman.
Delegate Hope.
If I could add on my bill, everything that Delegate Orrock just stated is true. There's one other thing, is that it will also save lives.
Okay, small detail. Okay. Any further discussion?
Mr. Chair,
Delegate Bell.
the board is not showing, was it the motion to refer or report and refer?
Report and refer to appropriations.
Mr. Chair, could I have may I speak to that motion?
Absolutely.
Okay, so just for the new
Delegate
members,
Bell.
there's a motion to refer just means you're sending it someplace. It doesn't have any committee action. A report and refer means an endorsement by this committee, followed by the refer. Is that accurate, Mr. Chair?
That is my understanding.
Isn't that so? Thank you.
Yes. So we are approving the policy here today, and then whether we can fund this is the jurisdiction of another committee that has constrained resources. So any further discussion? HB 1090 is before us. All in favor, please indicate on the electronic voting device. And that bill reports out 10-9 with everybody in attendance. 13-9. I can see that. 13-9, I'm sorry. And thank you. We returned to HB 1040, Delegate Hope, because Council has confirmed that the needed line amendment was included in the bill. So we can, if there's no further discussion on HB 1041, please register your support for or opposition to the bill on the electronic voting device. And the bill reports on a vote of 13-9. Delegate Hope, your last bill.
Thank you, Mr. Chairman. House Bill 1257, save the best for last. This directs the State Board of Health to adopt regulations establishing maximum contaminant levels in public drinking water systems for PFOS, PFOA, and the other PFAS compounds. The bill requires such MCLs to be protective of public health, including the health of vulnerable subpopulations, and to be no higher than any MCL or health advisory adopted by the EPA for the same contaminant. The bill directs the board to consider certain studies in adopting such MCLs and to consider establishing other MCLs anytime two or more other states set limits or issue guidance on a given containment. The bill was reported with an amendment, and so I'd like to move the amendments.
Amendments are before us. All in favor, say aye. Aye. Any opposed? There is an additional amendment at the desk. Council?
Yes, and this was my error. The last the amendment that changes the date to July 1, 2022, that should actually be January 1, 2022.
Move the
Thank
amendment.
you.
Second.
Amendment's been moved and seconded. Any objection? Without objection, so ordered.
Mr. Chairman, the subcommittee reported with the amendments 5-2, and I so move.
The bill has been moved. Please register your...
Mr. Chairman.
Delegate Orrock, sorry.
Mr. Chairman, if you may, speaking to the motion, if you notice there were some negative votes in subcommittee, and just to explain those, two items. One, I would just bring to the committee's attention the fact that we would be implementing regulations based on what any two of the other 49 states have done. And secondly, we have already supported House Bill 586, which creates a study on this matter. And I, for one, think it's very inconsistent that on the one hand, we're going to study the issue, but already presume on the outcome of said study, where legislation would go forward even with a delayed effective date, that presumes that outcome is going to require regulations. I just think that's inconsistent with past practice. I think the bill before us is premature, and so that's why I'll be voting no.
Mr. Chair.
All right, Delegate Rasool.
Thank you, Mr. Chair. We ended up striking Section C, which gave out the broad clause in consultation with the Manufacturers Association, who removed their opposition to the bill with a delayed effective date. I think it gives us good time. More broadly, though, this the study only covers a certain set of the compounds. Here we are trying to join other states who are setting maximum contaminant levels of what's called forever chemicals, because these chemicals do not degrade over time. So I think that we're giving the authority to the Department of Health to set the maximum contaminant levels, and now is the time to do it.
Delegate Rasool, the statement was made that we would have to follow what any two states decided to do. Could you explain that, why that is or isn't true?
Thank you, Mr. Chair. That section was deleted in the substitute, in the amendment.
Thank you. So the gentleman from Carolina apologizes.
We love him. We love him anyway because we're from Roanoke.
He's really, on average, is a net plus to the body.
Some days. If you look at his entire career.
Yeah, you have to look over the entire career, yes. Body of work. So HB 1257 is before us on this maximum contaminant level in your water bill. All in support of this, please vote aye on the electronic voting machine. And this bill passes on a vote of 13-9. Thank you, Delegate Hope, for that report and all those bills that you spent so much time on. Yep. So we're going to incorporate on a block vote on the bills that we just rolled in together. And so that block vote is before you. And the council will explain.
We need to vote on each of we had several bills that had other bills rolled into it, incorporated into them. We need to vote on the bills that were rolled into other bills, just to wrap those motions up. So these are the bills that have been rolled into other bills that were just reported out of the subcommittee. If you look through your docket, it's noted in your docket which bills went where. This is a sort of a cleanup matter.
So moved.
Okay, it's been moved and seconded. Please register your support or opposition. Oh, it's a voice vote. I'm sorry. All in favor say aye.
Aye.
All opposed? Okay, the ayes have it. Thank you, Delegate Hope. Moving on to the Health Professions Subcommittee report. Delegate Adams.
Thank you, Mr. Chairman. I would request that we bring up HB 1040 out of order.
So ordered.
We have a request by the patron that House Bill 1040 go by for the day.
I have a motion. Is there a second? All in favor of going by for the day on HB 1040, say aye. Bill is by for the day.
Thank you, Mr.
Delegate
Chairman.
Adams.
Thank you, Mr. Chairman. House Bill 362, patron by Delegate Rasool, report with amendments. A capacity determinations physician assistant expands the class of healthcare practitioners who can make the determinations that a patient is incapable of making informed decisions to include a licensed physician assistant. The bill provides that such determinations be made in writing following an in-person examination of the person and certified by the physician assistant. This did report from committee with amendments.
Are you moving the amendments?
Yes, I'm moving the amendments.
All in favor say aye. Any discussion on the bill? Expanding the scope of practice modestly. All in favor of HB 362, please indicate on the electronic voting machine. Delegate Adams.
Thank you, Mr. Chairman. HB 386, patron Delegate Hope. This bill prohibits any health care provider or person who performs counseling as part of his training for any profession licensed by a regulatory board of the Department of Health from engaging in conversion therapy, as defined in the bill, with any person under 18 years of age, and provides that such counseling constitutes unprofessional conduct and is grounds for disciplinary action. The bill provides that no state funds shall be expended for the purposes of conducting conversion therapy, referring a person for conversion therapy, extending health benefits coverage for conversion therapy, or awarding a grant or contract to any entity that conducts conversion therapy or refers individuals for conversion therapy. This bill reported with amendments, and I so move to report the amendments.
Amendments have been moved. All in favor say aye. Are there any questions on the bill? Any discussion? HB 386 is in front of us. Please indicate your support or opposition on the electronic voting device. And the vote passes 19-3. Delegate Adams.
Thank you, Mr. Chairman. HB 641, patron Delegate Hurst. This eliminates the prohibition on sale or offering for sale of caskets by a person other than a licensed funeral service establishment or funeral service licensee in cases in which pre-need funeral arrangements for funeral services are being made. The bill requires funeral service licensees to accept caskets provided by a third party in accordance with the requirements of federal law, but makes clear that no funeral service establishment or funeral service licensee may be required to store a casket provided by a third party when pre-need arrangements for funeral services have been made. This reported to committee with amendments, 6-0.
Move the amendments.
I move the amendments.
All in favor of the amendment, say aye.
Aye.
Any questions about HB 641?
Mr. Chairman,
Delegate Orak.
if I may, the language that's being stricken, if I recall, was put there at the request of folks in the industry on a bill that I carried last year. And I would just ask, were all the industry folks in support of removing this language that they thought we needed last year, but obviously we might not have?
I see someone who has risen. Mr. Keeney.
So I had way too much fun last year carrying this, and now we got it right.
Mr. Chairman, members of the committee, Bo Keeney, representing Association of Independent Funeral Homes of Virginia. Industry is fully supportive with the amendments that were presented at subcommittee.
Thank you.
Mr. Keeney, so are all of our various funeral associations supportive of the bill?
My understanding is yes.
Okay, thank you, Mr. Keeney. Okay, any other questions? HB 641 is before us. Please indicate your support or opposition on the electronic voting machine. And the bill reports on a vote of 22-0. Delegate Adams.
Thank you, Mr. Chairman. HB 1059 is a very good bill, patroned by myself. This authorizes certified registered nurse anesthetists to prescribe Schedule 2 through 6 controlled substances and devices, provided such subscribing is in accordance with the requirements for practice by certified registered nurse anesthetists. This reported with amendments, and I so move the amendments.
Is there any questions about HB 1059, nurse anesthetist? Not that this has ever been debated before. Are we going to get a cheer out there if we pass this? Okay. Before us is HB 1059. Please register your support or opposition on the electronic voting machine. And the bill reports 22-0. All right. Delegate Adams.
Thank you, Mr. Chairman. HB 1121, patroned by Delegate Robinson, reports with substitute. Do you want to move the substitute?
Substitutes before us. All in favor, say aye.
This bill provides that an applicant who completed a massage therapy educational program in a foreign country may apply for licensure as a massage therapist upon submission of evidence that the applicant is at least 18 years old, has successfully completed massage therapy educational program that is comparable to a massage therapy educational program required for licensure by the board, and has not been subject to disciplinary action that result in a denial of licensure. The Board of Nursing shall issue a license to an applicant who completed his massage therapy educational program in a foreign country upon and submits evidence of completion of the English language version of the licensing exam of the Federation of the State Massage Therapy Boards or a comparable examination.
Committee, I have been notified that due to the English language requirement here that our esteemed courts committee would like to hear the bill for civil liberties reasons, and so the motion would be, whoever makes it, is to report and refer to the Courts of Justice Committee.
Move to report.
And it's been moved and seconded. All in favor of reporting and referring to courts, say aye.
Aye.
No, register your support or opposition on the machine. Thank you. And the bill passes on, I pushed the button. Okay. And the bill passed on a vote of 21-0. Thank you. Is there one more bill?
Yes, sir, Mr. Chairman. HB 1304, patroned by Delegate Hodges, reports with a substitute.
The substitutes for us. All in favor, say aye.
Aye. This bill amends the eligibility criteria for registration as a pharmacy technician to include a requirement that the individual has completed a training program that is an accredited training program by the Board of Pharmacy, operated through a federal agency or branch of the military, operated through the Department of Education's Career and Technical Education Program, and the applicant has successfully passed the national certification examination administered by the Pharmacy Technician Certification Board or the National Health Career Association. The bill defines pharmacy technician trainee and sets out requirements for registration as a pharmacy technician trainee.
Is there any discussion? All in favor of HB 1304, the substitute, please indicate on the electronic voting machine. And the bill passes on a vote of 22-0. And thank you, Delegate Adams, for just a fine subcommittee report. Moving along to Social Service Subcommittee, Delegate Guzman. I'm sorry. We need to reconsider.
I move that we reconsider House Bill 586 for the purpose of an amendment.
So all in favor of reopening a vote, please say aye. Aye. Reconsidering, I mean. And the council will explain why we need to reconsider this vote.
Thank you. We have a last-minute addition to the substitute that was discussed in the subcommittee. So on line 21 of the substitute that's before you,
96.
after public drinking water, insert a manufacturer with chemistry expertise, comma. So it's adding a manufacturer with chemistry expertise to the work group.
So does everybody understand the amendment? And this is to Delegate Guzman's drinking water bill on this. So it's the substitute to HB 586.
Yes.
So all in favor of the amendment, say aye. To add this person. Opposed? Okay, so now we're going to take a second vote to report the substitute to HB 586. All in favor indicate on the electronic voting device. Thank you for that little bit of administrative help there. Okay, Delegate Guzman on your Social Services Subcommittee report.
Thank you, Mr. Chairman. House Bill 566, Patron Guzman. I would like to present the substitute.
The substitute's been distributed. All in favor of substitute, say aye. Aye.
Mr. Chairman, this bill incorporates House Bill 391 from Delegate Scott, House Bill 786 from Delegate Bagby, House Bill 814 from Delegate Ward, and House Bill 1130 from Delegate Lopez. This bill has reported and been referred to appropriations in a vote 6-0. It talks about eligibility for food stamps and TANF drug-related felonies, provide that a person who's otherwise eligible to receive food stamp benefits shall not be denied such assistance solely because he has been convicted of a drug-related felony. Under current law, such individuals may not be denied food stamp benefits based on a felony conviction of possession of a controlled substance in violation of 18.2-250, provided that such a person is complying with or has already complied with all obligations imposed by the criminal court, is actively engaged in or has completed a substance abuse treatment program, participates in periodic drug screenings, and meets any other obligations as determined by the Department of Social Services. The bill also provides that a person who's otherwise eligible to receive TANF benefits shall not be denied such assistance solely because he has been convicted of a felony offense of possession of a controlled substance in violation of 18.2-250, and I so move.
Does everybody understand the bill? Any discussion on HB 566. We have a substitute before us that needs to be reported and referred to appropriations. Is there a motion to do so? A second? So please register your support for reporting and referring on the electronic machine. And the vote passes on a vote of 18-3. So moving along to HB 747, Delegate Guzman.
Thank you, Mr. Chairman. House Bill 747 from Delegate Watts. It has been voted to be continued to 1021,
And you so move.
and I so move.
All in favor of continuing HB 747 under Rule 22, please say aye.
Aye.
Opposed? Okay. Next bill, please.
House Bill 799, Delegate Askew. It's being reported and referred to appropriations in a vote 6-0. It talks about child day programs. Potable water lead testing requires licensed child day programs and certain other programs that serve preschool age children to develop and implement a plan to test potable water from sources identified by the U.S. Environmental Protection Agency as high priority. The bill requires such a plan and the results of each such a test to be submitted to and reviewed by the Commissioner of Social Services and the Department of Health's Office of Drinking Water. The bill stipulates that if the result of any such a test indicates a level of lead in the potable water that is at or above 15 parts per billion, the program shall remediate the level of lead in the potable water to below 15 parts per billion. Confirm such a remediation by retesting the water and submit the results of the retests to the Commissioner of Social Services and the Department of Health's Office of Drinking Water for review. The bill also provides such programs the option of using bottled water in lieu of testing or remediation. The bill has a delayed effective date of July 1st, 2021, and I so move.
Is there any discussion on HB 799? Everybody understand the bill? Please register your support on the electronic voting device. And the bill reports on a vote of 22-0. Delegate Guzman, we are going to pass HB 809 for a reason we'll explain in a minute. And could you continue to HB 920, please?
Yes, Mr. Chairman. House Bill 920, Patron Delegate Brewer. I would present the substitute.
There is a substitute. Is a substitute before us? There's a substitute before you. All in favor of substitute, say aye. Delegate Guzman.
Thank you, Mr. Chairman. House Bill 920 has been reported and referred to appropriations in a vote 6-0. It talks about the state-funded Kinship Guardianship Assistance Program, creates the state-funded Kinship Guardianship Assistance Program to facilitate child placements with relatives, including 50 kin, and ensure permanency for children in foster care. The bill sets for eligibility criteria for the program, payment allowances to kinship guardians, and requirements for kinship guardianship assistance agreements. The bill also expands eligibility for the federal-funded Kinship Guardianship Assistance Program by allowing payments to be made to fictive kin who receive custody of a child of whom they have been the foster parent, and I so move.
Okay, the motion is to report and refer to appropriations, HB 920. Any discussion on the motion? Any questions of the patron? All in favor of reporting and referring, HB 920, please indicate. And the bill reports and refers by a vote of 22-0. Delegate Guzman.
Thank you, Mr. Chairman. House Bill 933 from Delegate Carol Foy. I would like to present the substitute.
The substitute has been distributed. adopt substitute? All in favor of adopting substitute, say aye. Delegate Guzman.
Thank you, Mr. Chairman. This bill incorporates also House Bill 917 from Delegate Brewer. This bill has reported and referred to appropriations in a vote 6-0. It talks about Kinship Guardianship Assistance Program, eligibility 50 kin, expands eligibility for the Kinship Guardianship Assistance Program by allowing payments to be made to fictive kin who receive custody of a child of whom they had been the foster parent, and I so move.
Bill has been moved. Is there any discussion, further discussion on the bill? All in favor of HB 933, please indicate on the electronic voting device. And the bill reports on a vote of 22-0. Delegate Guzman.
Thank you, Mr. Chairman. House Bill 1006 from Delegate Herring reports 6-0. It's about human trafficking assessments by local departments. Changes the name of sex trafficking assessments to human trafficking assessments and allows local departments of social services conducting such human trafficking assessments to interview the child victim or his siblings without the consent and outside the presence of such a child's or sibling's parents, guardian, legal custodian, or other person standing in loco parentis or school personnel. This bill is a recommendation of the Virginia State Crime Commission, and I so move.
Is there any further discussion on the bill? All in favor of HB 1006, please indicate on the electronic voting device. And the bill reports on a vote of 22-0. Delegate Guzman.
Thank you, Mr. Chairman. House Bill 1209 from Delegate Tran. I believe there is a substitute
Yes.
offered to us
Yeah,
here.
the substitute has not been distributed, or has it?
Mr. Chair, there was a substitute that was adopted in the subcommittee, and I believe there is a new substitute that the patron would like to
So
distribute.
the patron has a new substitute, and is the patron here?
Yes, I am,
Yeah,
Mr. Chair.
I forgot. Okay.
Mr. Chair, move to reject the committee substitute.
Mr. Chairman.
Delegate Orrock, speaking to the motion to reject the substitute.
Well, point of order, the motion parliamentarily should always be placed in the affirmative, so we would move to adopt, but everybody should then vote no.
So please vote no when we ask you move to adopt the substitute.
I move to adopt the substitute. Please vote
All in
no.
favor say aye. No.
No.
Okay, the substitute is rejected. And Delegate Tran, can you explain your new substitute?
Thank you, Mr. Chair. The new substitute helps to clean up some of the language around the advisory board so that it more aligns with advisory boards that have been in the code for other, created for other purposes, so that they're a little bit more aligned. So it just cleans up some of that language. The other was a technical change that the Department of Social Services asked us to make, where in the original substitute, the Office of Newcomer Services, which is currently established to provide services only to refugees that are resettled in Virginia and funded entirely with federal dollars, grant money, was a division within the Office of New Americans that's newly created through this bill. And the Department of Social Services asked us to have them as separate entities because one office is entirely funded by federal dollars and makes it a little bit more clear in those delineations of responsibilities and funding.
Delegate Avioli.
Mr. Chair, thank you. I would like to speak and offer a few comments on this particular bill by Delegate Tran. I speak on behalf of myself as an immigrant. I speak on behalf of myself as being a naturalized citizen and the trials and tribulations that went through to get to that process. The American dream started for me and my family in 1960 when we were afforded the opportunity to come to this great country to pursue that dream. And it was not easy, rather very difficult. In fact, that visualizing yourself as a new person in this country, documented legally, not speaking English, having to start school as a youngster, again, not speaking a word of English at 10 years old, that's pretty traumatic. And I interpreted for my mother at the parent-teacher conference. I was the best kid in the world, believe me. What I told her from the teacher was very, very nice. To make a long story short here, the process of legal documentation, citizens who are taxpayers, they're here for the American dream, as well as those holding green cards, has become an arduous process. Mine was very simple, a simple application, a simple fee, and we're now talking about thousands of dollars for people who are, again, documented here legally, and on top of that, the opportunity to get through a green card, now citizenship. I wholeheartedly support this, and the reasons that I've given, I stand by. Thank you very much, Mr. Chair.
Thank you. Are there any questions on the substitute?
Mr. Chair,
Delegate Bell.
I wasn't in the subcommittee. Is this the first time we're seeing the substitute, or is it?
It is the first time, and would you like a little bit more time to read, or do you have a question for the patron?
Maybe both.
Delegate Bell, maybe
me
she
ask.
could explain
Yes,
her substitute, or she did that. Or you have further questions of her about what she described in the substitute?
I have some questions. I'm happy to direct them to the staff or to the patron. I
Okay. You have the floor.
Okay. Understanding that this is, as we say in courts, a lot of words, 4 pages that we haven't seen before. It repeats the word new Americans over and over, and I'm guessing that that means something or is defined somewhere. Sometimes it's capitalized, sometimes it isn't. Can someone tell me who we're talking about?
I think council can speak to that.
I can. First off, in the places where it is capitalized, we are referring to the Office of the New Americans or the Office of the New Americans Advisory Board. In other places, it is not capitalized, and that's referring to the individuals that would be served by these entities. I do not believe the term is defined, however.
Delegate Bell.
Okay, I mean, Delegate Avioli, talked about people that are documented and on the road to or in the process of becoming or who have recently become citizens. Is that what this is about? Because I don't see that anywhere in the 4 pages of new words.
Delegate Tran, I think it's a question for you. Can you repeat the question?
That would be appreciative. Thank you.
What the question was, I mean, who is this intended to serve? Right? The term New Americans is used, it's got to be 40 times in here. When that happens, that is used as a defined term. I don't know who the term is defined or what it means. Delegate Avioli expressed support for doing this for people that are either recent citizens or on the way to be citizens or in the process of becoming citizens but otherwise documented. Is that the population that the delegate hopes to serve with this bill?
Mr. Chair, if I may respond.
Delegate Tran.
I would say to the delegate, lines 76 and 77 talks about the office providing assistance on the citizenship application process, which is obviously for those who are eligible for citizenship and have legal presence. But I think we're all aware that there are a number of different types of immigrants who reside in Virginia, from those who currently are on a pathway to citizenship, as well as those who are on different types of work visas who are not, as well as those who are undocumented. And this office provides an opportunity for our state government to do some big picture thinking and visioning and looking across all of our policies around how to be best efficient in serving a wide, diverse group of immigrants and refugees who contribute to our economic, social, and cultural fabric.
Mr. Chair.
Delegate Bell.
All right, so just so nobody is misunderstanding what this, the gentlelady described three groups, those that are sort of on their way, those that are sort of in the process of getting on their way, and then those that are not. And this would serve all 3, is that right?
Delegate Tran.
Mr. Chair, I would say that he is correct in that description.
Okay. Your further question? Delegate Bell? Delegate Guzman.
Thank you, Mr. Chairman. Speaking to the comments and to the bill at the appropriate time.
You have the floor.
Thank you, Mr. Chairman. I would address the comments from Delegate Bell that the reason why we are creating this office is exactly why people don't understand what it means. And I think that this could be a responsibility absorbed at the Department of Social Services due to the lack of knowledge of what New Americans means. According to the last census, there is approximately 13% of New Americans residing in Virginia. And I think that the definition of what it's included or not could be the job of this office that will be created exactly for the reasons that are addressed, Mr. Chairman.
Mr. Chair.
I'd like to speak
Delegate
to
Bell,
the-
thank you for your request to speak. I
like to-
see that you did that.
I'd like to speak to the bill. at the
Speak
appropriate
to the
time.
bill.
All right, so I want to vote against this bill, and I think that it continues the effort to conflate those that are here, legally documented, either having just finished or in the process or making the effort to complete the process, with those who are not. I think that's a mistake, and I'll be voting against the bill. Thank you.
Anybody else
Mr.
speak on the bill?
Mr. Chair.
Delegate Rasul.
I will-
Delegate Rasul. Sorry, man. Sorry. Delegate
Move that
Rasul.
we report the bill
Okay, the bill's been moved. Is there a second?
and refer to appropriations.
The motion is to report the bill and refer to appropriations. Is there a second? Second. Okay, please, if there's no further discussion, please indicate your support or opposition on the electronic voting device. And the bill reports 17-5. And good luck upstairs. Very good. And Delegate Guzman.
Thank you, Mr. Chairman. House Bill 1410 has been reported and referred to appropriations in a vote 5-0. Patron is Delegate Roem. It talks about food stamps and restaurant meals programs, directs the Department of Social Services to participate in the restaurant meals program of the Supplemental Nutrition Assistance Program, SNAP. The bill requires the department to develop and implement a plan to begin such a participation no later than January 1st, 2021, and I so move.
Are there any questions on 1410?
Mr. Chairman.
Delegate Auroch.
Yeah, just speaking to the matter before we act on the bill, just understand that this will allow individuals who are receiving food stamps with the intent behind that they can go to the grocery store and purchase needed supplies for the family to now go to a restaurant and do same. The concern I have with that is I don't think we've got sufficient funds in the food stamp program to necessarily meet the needs of families now. That's a federal program, but this now further dilutes the monies they receive to allow them to go out to a restaurant and get less food for more money. So thereby, I'll be opposing the matter.
Does anybody have a comment out before we ask Duke to comment on that?
Thank you, Mr.
Commissioner.
Chairman. I would, speaking to the bill,
Delegate Guzman.
thank you, Mr. Chairman. I believe that the patron explained to us that the amount of eligibility assigned to this recipient will not change. We're trying to address the needs of the homeless population when they are provided with food stamps, but they don't have access to cook a meal. So they will use that money to go to a restaurant and have a meal, a warm meal. Even right now, if a person goes to a 7-Eleven, they could buy a sandwich as long as it's not warm up with their food stamps. But if they put it in a microwave, they are no longer eligible. So this bill is trying to change that and allow the homeless population to get access to warm and cooked meals, Mr. Chairman.
Thank you, Delegate. Delegate Samira.
Mr. Chairman, I just wanted to add, I grew up on the south side of Chicago and worked at my uncle's supermarket where we accepted a lot of food stamps. And I will say that this is a tremendously big step in a good direction, because a lot of individuals that walk into supermarkets with food stamps end up buying chips and artificial flavored water and a lot of things that are of low nutritional value. And I think restaurants offer a higher nutritional value overall for in many different ways. And so I want to lend my big support for this bill. Thank you.
Thank you, Delegate Samir. Any other comments before we vote on this matter, which needs to be reported and referred to appropriations? And it was the recommendation of the subcommittee to do so on a 5-to-1 vote. The one did not make it on your printed version there, so there was one vote opposition in subcommittee. And so the motion is before us. Please indicate your support or opposition on the electronic voting device. And the bill reports on a vote of 15-6. Thank you, Delegate Guzman. Now can we return to HB 809? The bill was heard in subcommittee, but apparently there was no motion at subcommittee. And so the bill's before us now. Is Delegate Delaney, can you explain your bill on HB 809?
Yes, Mr. Chairman. You okay, Mr. Chairman, if I stay?
Yes.
All right, Mr. Chairman and members of the committee, the bill before you requires the local Department of Social Services to conduct an investigation or family assessment when, among other things, a report or complaint of child abuse or neglect is received in which the alleged abuser is the child's parent, relative by blood, marriage, or adoption, caretaker, or parent's intimate partner. So currently, the only relations identified in the code which require the Department of Social Services to investigate when presented with an allegation of child abuse or neglect are those between the alleged abused child and either their parent or the person who is responsible for their care. As we know, the family structure has drastically changed since this code section was written, where children nowadays are often supervised by other intimately interact with adults who are not their parent or responsible for their care, such as aunts, uncles, grandparents, step-parents, or domestic partners of the parent. In the last year, the Department of Social Service screened about 8,260 reports of abuse and neglect due to an adult in question not falling into that narrow definition in the code. So that's 8,260 reports that could not properly be investigated because of the way we define caregiver in the code. So HB 809 expands our narrow code language around who can be the alleged abuser in cases of which the Department of Social Service investigates when presented with allegations of child abuse and neglect, to include who is actually a substitute that I will like to move, and I'll explain the substitute and leave it there. So the original bill had a much broader scope that would have included those 8,260 reports. The substitute before you has a more narrow definition to address that issue that would result in about 1,257.
Okay,
So
Delegate Delaney, the council tried to put this substitute online last night. It did not make it online, and so this is a lot of text. So I think we need to go by for the day. If it's a will the committee just go by for the day and come back to this in our next committee? So I would welcome the motion
for the day.
All in favor of going by for the day, say aye. Okay. Thank you. Everybody read up on her important bill for our next full committee meeting, 809. So that completes Delegate Guzman's report. Am I correct? So we're
Yes,
moving.
Mr. Chairman.
Pardon me? Okay. We need to take a block vote like we did last time for bills that were incorporated into other bills, and so that block vote is before you. And all in favor of moving the block, this number of bills that were moved into another bill, say aye. Aye. Opposed? Thank you. Thank the committee. Now moving to some full committee matters that have not been heard. Delegate Hayes, HB 907. Can you tell us about your sickle cell anemia bill? I
Thank you,
believe you
Mr.
have a substitute,
Thank you, Mr. Chairman. We do have a substitute.
but just one second. Hold on. Do you want to do my bill while you're handing this out? This is moving kind of quick, and I apologize for the delay. We're just handing out paper here. I don't think this bill is controversial, and that's why it wasn't heard in subcommittee, but we shall see. If it is, we will send it to subcommittee for further discussion. Is everybody prepared now to hear Delegate Hayes' presentation? Delegate Hayes.
Move the substitute, Mr. Chair.
The substitutes before us, all in favor? Aye. Okay. Substitutes properly before us.
Thank you, Mr. Chairman, members of the committee. The background information is that on HB 907 is a provision of adult sickle cell services. Increased sickle cell-related mortality has been shown in the 18 to 30-year-old range, with the highest rate of acute care encounters and rehospitalizations in the age group compared to the older group of patients who would be expected to have increased illness and complications due to the advancing age. According to the Virginia Department of Health data, the rate of emergency department visits for sickle cell disease is in Virginia was highest among 18 to 30 age group at 53.8 ED visits per 10,000 in 2018, and in 2019 it was at a rate of 55.3 per 10,000 visits. For those who are unaware, sickle cell disease is a group of inherited lifelong blood disorders that affects the red blood cells, and sickle cell disease disproportionately affects African Americans, but is also common in people with a Hispanic background. Sickle cell affects every organ of the body. Complications include severe pain, stroke, acute chest syndrome, organ damage, and in some cases, premature death. And there's much other information, but I'll just summarize by simply saying we have done a tremendous job, Mr. Chairman, members of the committee, with tracking and following and providing services for those from birth through 18, that pediatric care age range. But what has happened is once those patients that have been tracked via pediatric care become adults, the mortality rate is such less than desired. So we're looking to stand up a process, a voluntary process, that those adults with sickle cell disease between the ages of 18 to 30 would be able to be tracked and followed to mirror the model that we have for those that have been followed under pediatric network care. And before you, Mr. Chairman, members of the body, that is the bill.
Are there any questions for the patron? Thank you for bringing this bill. Unfortunately, it would have to be reported in if you approve the and refer to appropriations. Delegate Adams,
Thank you, Mr. Chair. Speaking to the bill.
you have the floor.
I just wanted to reiterate the significance and importance of this very important bill. I actually put in a budget amendment for the treatment and wraparound supports for sickle cell disease. Sickle cell anemia is much more than a disease of just crisis and pain. It is a killer. The median death for this population is actually 47 to 49 years of age. The significant mortality concerns are stroke, the cost of stroke and the disability associated with stroke and related cardiovascular disease is quite high. And this is extremely important to set up screening programs for this population, and I support and I'm grateful for Delegate Hayes for bringing this forth.
Thank you. Are there any further comments on the bill? All in favor of reporting and referring to appropriations, please so indicate on the electronic voting device. The bill is reported and referred on a vote of 22-0. Delegate Price, we have 1445. Delegate Price.
Mr. Chairman and members of the committee, reproductive health care should not be prioritized or determined by race, zip code, gender identity, or citizenship status. House Bill 1445 seeks to bring equity to reproductive health care access as a medical and economic issue. The bill would establish comprehensive coverage for a full spectrum of reproductive health services for all Virginians. It would provide a non-discrimination protection and increase access to products and services within reproductive health to all Virginians. It also addresses the 40-quarter rule that our esteemed chairman is working on as well. But there are some issues that we need to address, including possible state plan amendments for proper implementation aligns with federal regs and laws, so that I would ask the committee to carry over House Bill 1445 until 2021 and ask the chairman if I've already talked to him. It's okay. To convene a joint work group between HWI and Senate Education and Health so that we can evaluate the best ways to implement and see how, I think, how greatly this could impact Virginians and those living in Virginia. But as a part of my presentation, I did not get this word to all of the advocates that had shown up today. So I ask for mercy and a courtesy for those that have traveled so that you can hear limited amount and very brief testimony because they have traveled here, and it can also give you an idea of what the bill would do.
Thank you. Are there any people in the audience that would like to speak in favor of HB 1445? Briefly, knowing that we're going to have a whole year to work on this.
So thank you, members of the committee. My name is Sarah. I'm with the Latina Institute for Reproductive Health in Virginia. We dream of a future where Virginians no longer face insurmountable barriers to accessing reproductive health care, where all families can thrive no matter how much they earn, who they are, or where they're from. But right now, the high cost of reproductive health care is pushing critical and affordable care deeply out of reach for thousands of Virginians, especially our neighbors with low income, people of color, immigrants, and survivors of domestic violence. We can and must do better. Thank you.
Thank you.
Good morning. My name is Kat Lopez, and I'm from Alexandria, Virginia. In June of 2019, I was admitted to my local hospital for excruciating pain in my abdomen. After a series of tests, including a CT scan, the doctor informed me that I had a 27-centimeter tumor that grew from my left ovary, and the surgery was going to cost $110,000. The insurance was going to cover 80%, leaving us to pay $25,000. As the eldest of 4 daughters to 2 immigrant parents with low income, I was terrified about how our family was going to cover this cost. After turning 19, I lost my health insurance. Unfortunately, paying for routine or unexpected reproductive health care services is not currently in my budget. As I am now applying for new health insurance, I worry that I could have more reproductive health care needs in the meantime. I am grateful that I had insurance during that difficult time, but I know firsthand that that is not the same for many Virginians. I believe that reproductive health care should be accessible to every Virginian regardless of income, race, gender, or immigration status. I believe that health care is a human right and not a privilege, and I honestly can't wait to see reproductive justice become a reality for all Virginians with the help of HB 1445.
Thank you very much. Thanks for coming down today.
Hi, I'm Rosario Blanco from Alexandria, Virginia. I am reading on behalf of Lorena Paredes from Falls Church. When I became a parent at 16, access to healthcare sometimes came with stigma and societal pressures that created barriers to my overall wellness and especially my mental health. As a young working student and mother, contraceptive measures were important for my future but expensive and not necessarily accessible. If REA had been in place during certain points of my life, affordable birth control would have been one less cost to worry about. Even now, post-graduation with a full-time career, co-pays and premiums for the higher-tiered, employer-based commercial plan can be costly and have sometimes deterred me from seeking quality health care. Why shouldn't the state I live in, work in, and raise my children and be positively impacting my overall wellness? Without the barriers and inequity, fundamentally, why shouldn't Virginia provide inequitable access for a strong and thriving life to each person who lives here, regardless of parental status, income, immigration status, gender identity, or expression? With the Reproductive Health Equity Act, help to see Virginia doing exactly this and for exactly every single person. Thank you.
Hello, my
Thank
name
you
is
so much.
Michelle Wooten McFarland. I'm from the Newport News area. I am here representing NARAL Pro-Choice Virginia, and we support this bill. Thank you.
Thank you. Delegate Price, any final words or any
Yeah, I
questions
just
for the patron?
appreciate the opportunity for us to give this a full and fair hearing, and that is the end of the people that are with me.
Okay, is there any opposition to the bill?
Mr. Chairman, members of the committee, I'm Jackie Gonzalez with the Family Foundation. I'm just here to highlight a few of the concerns that we have with this bill, and hopefully as you discuss going forward to 2021, those can be looked at and discussed and hopefully resolved. One of the things that we would like to highlight, there's so many, but I'll just highlight a few. First of all, the bill seems to adhere to the Hyde Amendment until the little exception on line 65 and 66, which basically then allows what constitutes as taxpayer-funded abortion. So that is definitely concerning. We've heard a lot about the bill being about helping the poor. Yes, helping the poor. And some of the testimony said that we don't want to leave anybody out. And we agree if we're going to help the poor with reproductive services, there's quite a glaring question about this bill, is that why are the reproductive health services only moving in one direction? I'm sure there's those who qualify for government assistance for whom this bill speaks. Do they ever need or desire fertility treatment? Why is that not in the bill if it's covering if it's a comprehensive coverage of reproductive services? Also, isn't it a bit too extreme to require same-day sterilization as line 219 to 220 states, but offer no provisions for reversals or fertility treatments should those that are eligible so desire? And then one last point I'd like to highlight is that this bill on the surface seems to provide a religious exemption, but it falls far short as it offers no conscience protections for individuals, for small businesses or nonprofits who may not carry a religious label as defined by this bill, but may find abortion or any other requirements of this bill being covered by this bill to be morally objectionable. So those are some of the concerns we have. There's many more, but those are some of the ones I wanted to highlight today.
Thank you.
And I hope that those will be discussed. Thank you.
Well, we invite you to participate fully in the activities over the next year. Yes, sir.
Mr. Chairman, point of order.
Delegate Hope.
Was it your intent to hear testimony today? I know you were doing the Delegate Price as a courtesy for people who traveled, but we're hearing statements about a bill that's going to be carried over to next year from people that are here in Richmond.
So I'm sure the Catholic Conference has concerns, and we welcome your participation in the study for years. Is there anything you'd like to say that is different than that?
Mr. Chairman, members of the committee.
Point of order, Mr. Chair.
Yep, Delegate Bell.
Or I guess a parliamentary inquiry. I mean,
Sure.
are we not, is this not a stage when we're taking some testimony about a bill?
Yep.
Before we take some action on it?
Well, I think we are, Delegate Bell, and I agree with you, because we allowed the proponents
all.
to speak, so we need to.
Same length of time or some other fair measure on both
Okay.
sides would be requested. Thank you.
Please continue.
Mr. Chairman, members of the committee, thank you. I will be brief, and we look forward to being part of these discussions moving forward. I won't repeat all the remarks from earlier, but I guess what I just want to amplify is from the perspective of our religious tenets and the tenets of our Catholic faith, we are not able to cover specifically the items of abortion, sterilization, and contraception in our health plans. And the only other point that I want to make that wasn't made before was that there is a federal law called the Weldon Amendment, and that prohibits discrimination by states against health insurance plans that do not cover abortion. So I would urge that as this moves forward, that be given careful consideration as well.
Thank you. Thank you.
Thank you.
Good
Mr.
morning.
Chairman, members of the committee, I'll be very brief. I'm Olivia Turner. You all know me. I'm the president of the Virginia Society of Human Life. I echo what Mr. Caruso just said, but Virginia Society of Human Life is a nonprofit
can
and
we be-
represents many such organizations in Virginia who are not religious-based. We are a non-sectarian organization. We work and operate out of Virginia. We are not protected because the Code of Virginia very narrowly defines the exemption under such a law as this would be to religious individuals with an individual religious perspective. So we are encouraging you in your conversations to add an amendment that would clarify that that nothing in this chapter shall be construed as requiring any carrier, covered person, provider, or employer to provide or purchase coverage for abortion if they object on an ethical, moral, or religious grounds. On that point, I think we must find some common agreement because we know that the taxpayers of Virginia have for many years voiced their concerns about paying for abortions. So if we're going to move in this direction, let us be respectful of those who object to abortion or paying for abortion on ethical grounds. And again, I highlight the Weldon Amendment, with just this week, President Trump is bringing the Weldon Amendment to bear on California for doing exactly what this committee and what, unfortunately, Delegate Price's bill could do in Virginia if we go forward. So please keep that in mind. We don't want the federal government breathing down our neck.
Thank you very much. Delegate Price.
Yes, I would just like for the record to reflect that I would be absolutely interested in adding fertility to the list of the many services that are provided here. So I look forward to that conversation, and just also to reflect my commentary that when you say the taxpayers, clearly some taxpayers spoke today. So I would use that qualifier of your supporters that pay taxes. Thank you.
Mr. Chair.
Delegate Rasool.
Mr. Chair, I move that we carry over House Bill 1445 under Rule 22 to the 2021
Is there
session.
a second? All in favor say aye.
Aye.
It is so carried over. Thank you. And now let's turn to, pardon me? We will invite the Senate to, well, we were going to write a letter to ourselves setting up this study, but we will also invite, we can't pass a joint study here, so we will invite the Senate to participate. So I'm moving along to HB 385, the practice of chiropractic, and it's a definitional bill. It's my bill. There is a line amendment. And so the bill is pretty self-explanatory. It clarifies the definition of practice of chiropractic to make clear that a doctor of chiropractic may request, receive, and review a patient's medical and physical history, including information related to past surgical and non-surgical treatment of the patient and controlled substances prescribed to the patients, and document in a patient's record information related to the condition and symptoms of the patient, the diagnosis of the patient made by the doctor of chiropractic, and the treatment provided to the patient by the doctor of chiropractic. So the line amendment on line 96 would strike the word diagnosis and insert examination and evaluation. And my understanding is that this language has been agreed to by the Medical Society of Virginia and the chiropractors there together. So this is not a controversial but necessary clarification of our code. Is there any further discussion?
Move the amendment.
The amendment's been moved and seconded. All in favor, say aye. Aye. Any further questions on this simple bill? It's been moved to report. Is there a second? So please register your support or opposition on the electronic voting machine. And the bill is reported out by a vote of 22-0. Thank you very much, everybody. And we're moved to our final bill of the day, which is HB maybe 997, Delegate Converse Fowler. But she is no longer here.
Mr. Chair, I believe that she is meeting with some of the victims from Virginia Beach, so I would move that we pass this bill by for the day.
It's been moved to pass by for the day. All in favor, say aye.
Aye.
Do we want to give this now? So, Delegate Robinson, I misspoke. I forgot about your bill. Would you like to take the podium and explain HB 1399? Or you can do it from your seat, whatever you wish. This comes from the first page of administrative actions.
Thank you, Mr. Chairman. This is a kind of a unique approach. This bill, I'm going to give you a little history of HB 1399, the Solemn Covenant of the States to award prizes for curing diseases. This past summer, the Speaker Pro Tem of Ohio called and met with several of us, and this is something that he is moving and going across the country, trying to get states to join together to find cures for diseases. Currently, our system isn't set up necessary to find cures because there's a lot more money in treatment. And then a lot of times, studies don't go beyond the animal. It never gets to the people. And so a lot of things go left uncured. This is not a partisan issue. This is a people issue. Finding a cure for a disease. And we have such good technology today to take us and to look at things so much more in depth than we've ever had before. We can get down and look at, the structure of DNA, and unlike we've ever been able to do. We have stem cell. We have lots of things that we can use, hopefully, to find a cure. And so this is really about people and the patients. Treatments are incentivized in the current economic system. 66% of new R&D is conducted by the private sector, and the remaining portion comes from government or charitable organizations. Public and charity research is only basic science and does not go beyond animal studies, which is why we see so many instances of cures in mice and other animals. Applied science research is needed to develop potential breakthroughs. Only if the private sector takes basic science and invests in human trials does it become a product for humans. Private sector picks potential products to maximize profits, and treatments are tremendously more profitable than cures. Since the war on cancer declared by Nixon in 1971 to the present day, there have been no results. No matter how much spent, nearly all government spending is basic science for new products, nothing beyond animal studies. The Cure Bill creates a multi-state compact following existing models. Its federal and foreign governments can join as non-voting members, and it only starts when 6 states decide to join the compact. And we have a lot of other compacts in the Commonwealth. A compact will identify at least 10 major diseases to target for eradication, and it's based on factors such as severity and cost. The compact will determine the 5-year taxpayer savings for each state in the compact if a disease is cured, and it's set up as a prize. In exchange for a cure, a patient in exchange for a cure and its patent, the compact will award the prize money. and will become basically the owners of the patent, and then they'll seek out to be manufactured and distributed at a cheaper cost. And so it's a long-term savings for the government and the public, and only when they start to, when they realize the savings, well, you start to see those payouts occur. Non-compact states and governments will pay royalties to offset expenses, and will pay actuaries and interest on loans, as well as refunds to compact states, and create extra incentives to join the compact. Businesses, charities, and individuals can contribute to the prize money, and the compact provides the necessary monetary incentives to discover cures. There is no cure, and if there is no cure, the taxpayer has no obligation and pays nothing. The more states and governments to join, the greater the prize will be to incentivize researchers out there to find the cures. And at worst, we see a huge economic activity as companies work and invest in developing cures with no, and again, this is not at a cost to taxpayers. So an example for, say, leukemia, the prize may be $50 billion, and a biotech firm has a 1 in 100 chance of success, or even a 1 in 1,000 chance for success in developing a cure. Investors are much more likely to find a $5 million, to fund a $5 million study if they can, find that cure, and they'll realize that prize. It's a unique idea, and it's a creative way to try and incentivize development for cures that could lead to eradication of major diseases, leading to happier, healthier, and longer lives for the people, and while saving money in the long run. And again, the risk of the taxpayer is basically what it costs for us to be a member of the compact. And right now, Ohio has passed this, and again, this is being sold, and presented across all the southern tier states right now, and Representative Butler is moving across the country with this concept.
Thank you. Delegate Orrock has a question for you, I believe.
Mr. Chairman, if I may, question of the patron. While I applaud the innovation embodied here, and as you yourself said, unique, and I have some discomfort going forward with this idea at this juncture, but I have some sympathy for what you're trying to achieve. Would the patron find it an unfriendly motion if I were to move to carry this over under Rule 22?
No, sir, I would not.
Mr. Chairman?
Yes, sir.
I would then move to carry over House Bill 1399 under Rule 22.
Is there a second? All in favor say aye. Aye. The Bill 1399 is carried over to the 2021 session.
Thank you.
I see that Delegate Converse Fowler has arrived, and we are looking forward to hearing your bill, HB 997.
Thank you, Mr. Chair.
Mr. Chair,
Delegate Rasool.
having voted on the prevailing side by which we passed by for the day, House Bill 997, move that we reconsider that.
The motion to reconsider has been offered. All in favor say aye. Opposed?
Thank you, Mr.
Delegate
Chair.
Converse Fowler, please tell us about your good bill.
Thank you, Mr. Chair, members of the committee. My bill, HB 997, repeals the sunset date on a measure that requires individuals to undergo fingerprints background checks for child care staff scheduled to expire this July. This legislation would allow the Department of Social Services to continue the current practice and regulation of comprehensive child care background checks. The Child Care and Development Block Grant Act was enacted in 2014 and mandates that states require national fingerprint background checks for all child care providers who are licensed, regulated, or registered under state law or receive CCDBG funds. This is a rare piece of legislation in which a fiscal impact would be present should this bill not pass. If Virginia ceases to comply with federal CCDB regulations as of July 1st, 2020, it is assumed that the state would incur a penalty equal to 5% of its discretionary fund grant award during state fiscal year 2021. For reference, in federal fiscal year 2019, Virginia's CCDF discretionary award was right under $100 million. Based on the award amount, a penalty of around $5 million would be withheld from Virginia's discretionary grant award in federal fiscal year 2022 of each year thereafter. Until the state complies with federal regulations, I hope the committee sees the need for the repeal of the sunset on this. Thank you, Mr. Chair.
Thank you, Delegate Converse-Fowler. Are there any questions from the committee for the patron? Is there anyone in the audience that would wish to speak in favor of the bill?
Hi, Chairman. Tara Ragland. I'm the Division Director for the Department of Social Services for licensing programs. The administration strongly supports this bill. Thank you.
Thank you. Yes, ma'am.
Hi, I'm Grace Reef with Child Care Aware Virginia, and I also want to express our support for this bill. People who might be at risk for the safety of children shouldn't be in the business of child care, and this bill not only complies with federal law, but also will ensure that children are safe. Thanks.
Thank you very much. Is there anyone in the audience who would like to speak against the measure? Seeing none, the committee moves by. It's been reported and seconded. All in favor of the bill, please indicate on the electronic voting machine. And the bill reports 22-0. Congratulations, and thank you for being our last bill. And is there any further business before the committee? Is there a motion to adjourn? Second, the committee is adjourned.